So I always had problems with my knees, but they were always uncomfortable at some level. Checking here for my appointment.
Okay.
Brenda came in with bilateral knee pain, and her x-rays showed that she had moderate osteoarthritis of both knees.
My husband sent an email to me about regenerative medicine. And when I read it, I said, I want to do this. It just seemed like the logical next step, given my previous efforts at diminishing the pain in my knees.
She had enough cartilage that we felt like stem cell therapy would give her a reasonable chance of building new cartilage on the cartilage that was frayed. And that's why we opted to do the stem cell, and we followed it up in 2 months with a so-called booster dose of platelet-rich plasma to continue the stem cells to regenerate cartilage.
Step right over here. Just up on the table on your stomach.
It's a bone marrow concentrate that is extracted from the pelvis area. And that's the first one.
We usually take 2 or 3 syringe fulls.
I'm a needle phobic and pain phobic. So those 2 questions were paramount for me.
We're going to process this in the centrifuge.
It wasn't painful like some of the things I've had. I likened it to a blood draw, and then it's over.
The way we get the PRP is to withdraw blood, usually from the arm, centrifuge it. The centrifuge is programmed to separate out the portion of the blood that is rich in platelets. Platelets have growth factors and healing factors that are released when the platelets are activated in the place that you inject them. And so the platelet-rich plasma triggers a cascade of other blood cells coming into the area to heal the injured area. Most people over the course of the first 2 months hopefully will get 50 to 60% improvement in their symptoms, and then more gradual improvement after that up to a year.
6 weeks almost to the day, no pain in my bursa. The one important piece for me is that this regenerative medicine allows me to live my life the way I choose and not have it dictated by the levels of pain I was experiencing. It's a gift. I mean, I think if anyone is having pain, I mean, you can, and I get emotional about this, but if anyone's having pain, this could be the answer.